For the first analysis that we have done, we can see this graph on the left. 80.6% of encounters are done at Shawnee County, although from our dataset there are 10 different counties where each department are located. Since the main mission of Stormont Health is community health across Kansas, the encounters should be distributed more equally to other counties and shouldn't be this extreme. Since county like Shawnee has population not significantly different with Douglas, with Shawnee at around 178,000 and Douglas at around 122,000. This needs further investigation into what could cause this to address the issue and to improve Kansas community health furthermore.
Okay, for the second slide, we have the Kansas health map. First, we have the medical procedure distribution and the department locations. The medical procedure distributions are represented as bubbles, and the department locations are represented as target markers. Now we can see that departments are clustered in Shawnee, as Marshall said, and there is more demand on the Central Country and Johnson Country. As we can see, the color varies and the bubble is bigger. And we also found an insight that the spontaneous vaginal delivery on the external data shows that the majority of the treatment is a spontaneous vaginal delivery. So, but in the top 10 distribution of the specialty of the departments, we have the most in emergency medicine departments. So the insight is we need to increase the obstetrics department of the health organization.
This chart shows the ED visit rate per disease group, not total volume, but the percentage of visits within each group that went through the emergency department. Bacterial infections and poisoning at the top make sense. They are inherently acute, but mental health at 7.21% and symptoms and signs at 8.15% stand out, both more than twice the hospital average of 3.41%. These patients came to the ED thinking they were in a critical condition, but after examination, their diagnoses were conditions manageable at a regular clinic. The gap here isn't clinical, it's awareness. So our recommendation, SVH should invest in community education to help patients recognize when a condition truly warrants an emergency visit.